If you have not subscribed to my channel, please do so by clicking on the subscribe button below. Hello friends, in this video I am going to tell you how to control diabetes, high blood pressure and high cholesterol. These three diseases are very much related. Diabetes is mainly caused by excess weight. This is why drugs like Simvastatin, the so-called statin drugs, and Fenofibrate are called weight loss drugs. So the idea is that if you can reduce your weight, you will also control high cholesterol and high blood pressure and diabetes. If you control high cholesterol, you will control diabetes and vice versa. I am not a doctor, I am a researcher. I have written 6 textbooks, and you can find my books by searching Google for quote, Barry Nirmal books, unquote. So this video is based on my research. But the best part is that this video is also based on my own life experience. My dentist detected high blood pressure when I was around 55. Then a few years later, my doctor said that I had high cholesterol. But I was much younger then, and I did not like to take too much chemical drugs. My blood pressure and cholesterol were caused by careless eating and drinking. If I had been more careful with my diet then, I would not be suffering from diabetes as I am suffering now. So my doctor told me to definitely take drugs to control high blood pressure, even if I ignored drugs to treat cholesterol. So I kept on taking high blood pressure medication, and this is why I am alive today to be talking to you. Then a few months ago, my doctor told me that previously I had pre-diabetes, which has now become diabetes, that is full-fledged diabetes. So he prescribed me metformin 500 milligram, 1 tablet with breakfast. The idea is that this drug will help control sugar in my food caused by food consumed throughout the day. I know that if I do not control my diabetes, my young doctor will keep on increasing the doses of my drug. First, he will increase the doses of metformin. Then he will prescribe me another drug like glimepiride. And if the two do not control my diabetes, then he will ask me to take insulin injections. One of my friends had diabetes. He did not take insulin as prescribed by his doctor. Being a divorced man, he ran away from USA to Africa, where he got a contract to teach. Many people go from USA to India, China, Russia, or Africa because they get lots of respect there. Anyway, my friend did not take insulin injections in Africa, and when he came back to USA, his doctor told him that he had kidney failure and had to undergo dialysis. So he used to undergo dialysis, and after a few years he developed cancer in his colon and he died quickly. I definitely do not want to undergo dialysis. This is why I did some research recently into how to control diabetes and high cholesterol and high blood pressure. Here are my recommendations. Number 1, intermittent fasting. There is a doctor in Canada named Dr. Jason Fung, F-U-N-G. He has spoken in many videos published on YouTube. He says that it makes sense to take insulin in type 1 diabetes, but in type 2 diabetes that I have, it makes no sense. He recommends intermittent fasting. As you know, Major religions like Hinduism, Islam, and Christianity have periods of fasting. Hindus have something called Ekadasi, which is on the 11th day of lunar month. It is a day of fasting and it comes every 2 weeks. Islam has Ramadan, where people fast for a whole month. Christianity also has a Lent, which is a period of fasting. The founders of these religions recognized that fasting is good for you. So I followed intermittent fasting for the past 1 week, as recommended by my guru, Dr. Jason Fung. Yesterday I skipped breakfast. I had had only lunch and dinner. The day before I skipped lunch. And the previous day I skipped dinner and so on. The effect of this fasting is amazing. Today at midnight, that is 5 hours after dinner, I took the reading of my sugar and it was 96, which is very good. Number 2, eating right. You must eat right. Try to eat only whole wheat bread. If you make your own bread like Indians and South Asian ladies make, so-called roti, you should use whole wheat flour only. Do not use flour which has refined flour which is white in color. In the USA, they are called enriched flour in stores. Indians call them maida. Stick to whole wheat flour and whole wheat bread. Try to avoid anything that has sugar like cakes, pastries, ice creams. Avoid any food that is manufactured in factories like cookies, potato chips, rotisserie chicken, and so on. These foods have too much sugar and salt added to them to make them delicious. Eat whole grains like barley, brown rice, buckwheat, bulgur, or it's also called cracked wheat. It is called dalia by South Asians. Eat millet, oatmeal, popcorn, whole wheat bread, pasta or crackers. You should definitely avoid cheese of any kind. High cholesterol is caused by animal products like meat and dairy. So avoid meat and dairy. But milk has all the nutrients that our body needs like protein, calcium and vitamin. So you may take milk or yogurt, but stick to low fat or no fat milk and yogurt. A few years ago, I read a story on BBC website. It talked about a Christian sect that lives in USA. It was found that the people of this sect lived healthy lives and they lived long, like more than 95 years. On further research, it was found that this religious sect had rules not to consume alcohol or meat, and they ate only fruits and vegetables, and they avoided alcohol. So the lesson that we can learn from this sect is loud and clear. Number 3, exercise. Exercise is very important. Did you notice that if you start exercising regularly, very soon you will feel that you have more energy. So if you can walk, go for a long walk every day. If your knee hurts and you cannot walk, then exercise on a bike. I exercise on a stationary bike for 30 minutes every other day. I should do this every day, but I feel lazy like most people. Number 4, take medications. Visit your doctor regularly and take medications he or she prescribes. I know many people, especially of the old school or old thinking, do not like to visit a doctor and do not like to take drugs. But regular visit to a doctor means he will tell you your conditions. He will remind you if your diabetes is getting worse or if your high blood pressure is not being controlled. So take the medications, but if you follow my advice, regarding intermittent fasting and eating right and regular exercise, you will need less of those medications. And if you have strong willpower and follow my advice aggressively, you will come off those drugs. But if your condition gets much better, your doctor will ask you to reduce the dose or stop taking some medications altogether. But try to find a good doctor whom you trust. If you do not like your doctor, please find another doctor. But do follow the advice of your doctor. Americans now live to the age of 90 and beyond. Those who live long and those who listen to are those who listen to their doctors, but also do their own research and follow advice of good people who create such wonderful videos like Dr. Jason Fung, Swami Ramadev from India, and so on. Number 5, check your sugar regularly. I check my sugar every other day because these days I am experimenting with some things and I want to verify that they work. Number 6, check your blood pressure every day or every other day. If you start intermittent fasting, you will find that your weight will start to come down and your blood pressure reading will also come down. Of course, your cholesterol reading will be found at your next blood test, which should be done every 3 months. Number 7, check your weight every day. This will remind you if you are losing weight or gaining it. If your weight is going up, your machine will tell you, and you will be reminded to cut down on the food that raises your weight, like alcohol, fatty foods, processed foods, desserts, and meat, and so on. Number 8, get your blood work done every 3 months. Let the doctor order blood tests and also urine test to check your sugar, A1C reading, your cholesterol readings, and other readings. If there is anything abnormal, you must work with your doctor to fix them. For example, if you have infection in your body, your white blood cells will be high. If your kidney is being damaged, your creatinine level will be high. Number 9, after waking up in the morning and before taking coffee or tea, drink 1 liter or 1 1/4 liter of lukewarm warm water. Do not drink more than this amount. Also, do not drink water with meals. You can have a little bit of water with meals. Just a little bit so that you don't feel dry in the mouth. But 1 hour after every breakfast, lunch or dinner, drink half a liter water at room temperature. This will cure your constipation without any medication. Constipation causes many diseases like diabetes, high blood pressure, and cholesterol. If you drink water as I have recommended, your kidneys will remain protected. Thank you, friends. Please write your comments in the comment box below. And also remember that worries is a very bad thing for us. Worries causes many diseases like diabetes and high blood pressure. And we should learn not to worry, because worry does not help us. It only makes things worse. Worrying about problems is not going to help you. You have to work to solve problems and not worry. I know it's easier said than done, but it must be said that worry is a cause of high blood pressure and diabetes and so on. Thank you very much. If you have not subscribed to my channel, please do so by clicking on the subscribe button below. You can also click on the share button and share this video with your friends on WhatsApp, Facebook, Twitter, or via email.